Good morning everyone. Today we'll talk about a new lesson which talks about smoking and its effects. Look at this cigarette. What do you think it's mainly made up of?
Let's look at what happens as their ingredients make their way through our bodies and how we benefit physically when we finally give up smoking. With each inhalation, smoke brings its more than 5,000 chemical substances into contact with the body's tissues. From the start, tar, a black resinous material, begins to coat the teeth and gums, damaging tooth enamel and eventually causing decay.
So the first harmful substance is tar.
Over time, smoke also damages nerve endings in the nose, causing loss of smell. Inside the airways and lungs, smoke increases the likelihood of infections, as well as chronic diseases like bronchitis and emphysema. It does this by damaging the cilia, tiny hair-like structures, whose job it is to keep the airways clean.
Let's look at the smoker's lungs and see what happens when smoking.
The lungs and blood. A toxic gas called carbon monoxide crosses that membrane into the blood, binding to hemoglobin and displacing the oxygen it would usually have transported around the body. That's one of the reasons smoking can lead to oxygen deprivation and shortness of breath.
The second harmful substance is carbon monoxide.
Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters, including endorphins, that create the pleasurable sensations which make smoking highly addictive.
So, nicotine is the third harmful substance that is found in cigarettes.
Nicotine and other chemicals from the cigarette simultaneously cause constriction of blood vessels and damage their delicate endothelial lining, restricting blood flow. These vascular effects lead to thickening of blood vessel walls and enhance blood platelet stickiness.
So after watching the video, try to list the effects of nicotine and other substances. Tars may affect the teeth, carbon monoxide narrows blood vessels, and nicotine may lead to addiction. Let's remember again the effects of smoking by watching another video.
Let's see how it affects the smoker. It causes oral and lung cancer and increases the risk of many other cancers. It also causes breathing problems and increases the risk of dangerous infections like pneumonia. Smokers have more of a chance of having a heart attack and are twice as likely to have a stroke. Smoking can even accelerate hair loss in men. Smoking also affects the eyes, and smokers are more likely to develop cataracts as they age. And it raises the risk of developing weakened bones or osteoporosis. Smokers tend to have yellow teeth and develop gum diseases, persistent bad breath, and other oral hygiene problems.
So we've learned that cigarettes contain harmful substances such as tar, nicotine, and carbon monoxide. Smoking may affect our body negatively.
Never to start smoking, as it is difficult to stop later. And if you already smoke, stop as soon as possible.
So smokers should stop smoking due to its harmful effects.